Hello, my name is Dr. Brandon Pettke. I am the Director of Nutrition for Curis Functional Health. And on today's video, what I want to do is speak specifically to those who are inching up to being almost pre-diabetic, or maybe you're pre-diabetic right now, or maybe you're full-on type 2 diabetic. If this is you, I want to discuss a different way to go about managing and addressing these health conditions. And the reason why I say that is if we look at type 2 diabetes, there are so many things that go along with it besides just the diabetes. Usually people that are type 2 diabetic, they usually have blood pressure issues. They have cholesterol issues. They have some type of other heart condition. They have circulatory issues. They get neuropathy many a times. You may not know this, but there's some big health complications that actually are due to type 2 diabetes. In fact, the number one cause of blindness, type 2 diabetes. Number one cause of kidney failure, type 2 diabetes. Number one cause of amputations in the lower extremity, type 2 diabetes. So as this disease process progresses, it unfortunately can create a lot of unwanted things, a lot of healthcare costs, and a massive decrease in quality of life. And so when people are diagnosed as pre-diabetic or type 2 diabetics, a lot of times they're given some general advice of, hey, you just need to change up your diet, or hey, you need to exercise a little bit more, or you need to take these medications. And a lot of times, frankly, people are given the diagnosis that once you're type 2 prognosis, I should say, once you're type 2 diabetic, you're always a type 2 diabetic. Well, we have found through our what's called functional medicine programs, we have found that to not always be the case. And in fact, many of our patients who go through our functional medicine programs are not only able to lower their medications, the vast majority drastically lower their medications, but many people actually are able to get off of their medications. And when I say that, I know I may have two heads when I say that, because you've never potentially heard that before, but that's exactly what we see clinically. And why is that? So let me tell you a little bit about functional medicine. The reason why we're so effective with that is because functional medicine, the whole purpose of it is to not just manage blood work or just manage symptoms and things like that. The whole point of functional medicine is to find out what is the root cause that is contributing to whatever this individual is dealing with. In this case, type 2 diabetes, right? So we can figure out what is the root cause that they're dealing with, and then we can develop a plan and put that plan together to then address that. Then we can make a massive difference in that individual's health. All right. So how do we do that? We do specialized testing. You may not have had it from your primary care physician. You may not have had it from your specialist. And so we go in, we look at genetic testing. We can look at advanced blood work. There's a number of different things that we can look at. And then, like I said, we can develop a plan for that patient, get to the root cause, massively change up the physiology of their body. And here's the amazing thing. The body has an amazing ability to heal if given the right environment. And if we can just figure out what is the root cause and then give it the right environment to reverse that, the body does some amazing things. And that's how patients are able to slowly lower their medication. And like I said, many of them able to actually get off of their medication. So anyway, if that's something of interest to you, I'm gonna encourage you to go look at our website, learn more about functional medicine. It's really easy. You just go to gocuris.com, click on the nutrition tab, and then click on functional medicine. There'll be all kinds of information there about functional medicine. You'll also have the opportunity there where you can actually set up a free 15-minute consult with one of our providers. So what we always do is we always want to provide that consult. We want to answer questions for patients. We want to find out more about their case and if we think we can help them or not. And if we do think we can help them, then of course we'll set them up for a full evaluation at that point in time. But before you spend any money, we always want to offer that free 15-minute consult. So if you're interested in learning more about functional medicine and potentially looking at doing a consult, then I highly encourage you to go over to our website and check that out. You can go to gocuris.com. Anyway, hopefully this information was useful, and I hope you have a wonderful day.